How do you feel about GLP-1s for children?
So I would say, again, thinking on the macro, I think it's tragic that we are at this place where that's really the only solution. And they are highly effective. I've used them a lot in my career, and we are seeing tremendous results. So, on an individual level, I think it can make a world of difference for patients. And I think that's true for adults and for adolescents. I wouldn't hesitate to use them personally
Okay.
when we've exhausted other approaches.
Okay.
And I think the benefits may outweigh the risk for the patient in front of me. But that's on a micro level. On a macro level, I lament that we're at a place where that's basically the only solution that we have.
Do you have any concerns about malnutrition in children? Because from what I've heard from adults that take them, I know a woman who said she was spoon feeding herself almond butter just to get calories in. And since kids are so picky to begin with, and maybe they'll only eat goldfish when they do eat, do you foresee that being an issue?
Yeah, I guess in theory it could be. I have not seen that in practice. These kids have such overexposure to calories leading up to the point where they need the medicine that they have a lot in reserve. And you could
Okay.
argue, well, they're not getting the proper micronutrients, and that very well may be the case. But I think that's a trade off I would make
Okay.
to treat the type 2 diabetes that's in front of you, or the fatty liver disease that's in front of you, that is going to age this child and lead to early death in many cases, whereas maybe somewhat some iron or vitamin B levels and so on, that's not as consequential as the metabolic disease that we're treating. So, like the saying goes, there's no solutions, only trade offs.